Hey there, I'm Dr. Shilpi Vidhani. I'm a plastic surgeon at SB Aesthetics Gurugram, and we do a lot of rhinoplasties in our practice. This video is for the people who are wanting to get rhinoplasty done, and in this video, I'll be breaking down the recovery process week by week. So stay with me until the end of the video where I reveal the cost of rhinoplasty at SB Aesthetics. So in the first week, generally, the splint is on, and when you have the splint on, you can't really see much of the shape. Some patients try to peek into their tip and see that what the tip is really looking like. But believe me, it's whatever you're seeing is not actually the real picture. And week 1, you will have the splint on. After a week, we remove the splint. In between, we call for a stitch removal, which is usually the stitch removal of this area and also the ala in some cases. Around the 7th day, we take off the splint, and that is the time when you actually take your first look of the nose that we have created for you. But in this also, you will see a lot of swelling. The marks from the splint would be there. So this again is not the right picture. A lot of patients get anxious. Some of them get very happy. So there are mixed emotions when the splint comes off. But in general, I will tell you that this is not even 50% of your result. But we do tape the noses on after that also. And generally, the taping that we do, we would like our patients to have them for about a week or so when they come back for a retaping. If you are from far and you want to travel back to your place, then we will teach you how to tape your nose, and that you can do on a regular basis, and we would like you to do it for at least 4 weeks. That will give you better results. Around the 2nd week, you will start seeing that, okay, the bruising that may or may not happen in your surgery will start to settle down after a week. So week 2, you see the swelling coming down. If you've bruised, then that bruise will turn into little yellow pigment, and you can see that it's gradually moving away. So with piezotome that we are using for ultrasonic rhinoplasty, generally the bruise is not bad, and generally after a week, you are much more settled in terms of swelling around the eyes that I'm speaking of. So in week 2, mostly the swelling goes down, down, down. 3rd week, when you look at yourself and you're still taping your nose. So after the 3rd week, when you take off your tapes, you will see that the swelling has started to come down drastically. Your dorsum seems to be more like you would like it to be. The tip is still swollen though, and you may, when you touch your tip, you may feel slight bogginess, but it is not yet time to keep touching your nose and keep looking at the mirror. And a lot of patients get so anxious about their result and they keep looking into the mirror, and the tapes definitely help to keep you off the mirror. So after the 3rd week, when the taping is not so intense, you can generally take the tape off. You can resume your activities. Maybe you can do a bit of treadmill if you want to, but no heavy exercises, please. Generally, heavy exercises we allow only after 2 months. So no deadlifts, no power lifts, nothing. So you have to understand that when you do all these high pressure things, the blood rushes, and then you can have a bleeding, you can have congestion. And congestion is also something that I want to talk about. Initial few weeks, you will face a lot of congestion because the mucosa is swollen, the tissue is swollen. It's not, the tissue is actually going through a recovery process. So definitely the body will swell up the tissues. So gradually the swelling will come down. 3rd week is the time when I tell my patients that most of the things start to look better. Around the 5th or 6th week, your nose will finally look like you want it to look. And especially with Indian noses, I would like to make a point that many of us have a very thick tip, a lot of fat around this area. So we do a lot of trimming down from inside. And that is the reason that the tip will swell a lot. So usually 6 weeks for thinner skin noses, but 3 to 4 months for the thicker skin noses, where you would actually start to see the shape. In the thicker skin noses, I would again like to make a point that you need to come back to us for injections for tip thinning. Maybe we will recommend you a laser, maybe some face creams, maybe something to put the oil down, because that will increase the swelling of the nose. Now, around the 4th month, 5th month, generally I would say if I have to put a percentage to it, then almost about 60% of the swelling is gone in 3 to 4 months. So after the 6th month, generally most of the things start settling down. This area swelling bothers a lot for a lot of people, and if you have bruised a lot, then please remember that you may have some collection of blood over here. So early on, it is very important for you to massage this area so that that blood collection does not turn into a bony hump or a bony deposition over here. Because you know that whenever there's a fracture, how does fracture unite? Fracture unites by depositing calcium in the hematoma or the blood collection that happens between the fracture. It's the same. If you have too much blood around here, if you don't massage later on, it will turn into a scar, and maybe it can turn into a bony swelling also later. So have some patience. Please wait out for your recovery. The tip is the one that settles the last, and that is why we say 12 months, especially in thick noses. You may start looking your best in 6 months, but I will again warn some patients that initially when you start wearing sunglasses or your spectacles on your nose, that can leave a mark which is long term. So please remember that early on in the early weeks, there's a lot of swelling, lot of repair happening. Do not disturb that repair process. Put your sun protection on. Do not hit the gym very early. But yes, later on, you need to be active and you need to massage and you need to wait it out patiently. So, okay, now the final deal. What is the cost of rhinoplasty at SB Aesthetics? So, I would like to tell you that we have rhinoplasty prices ranging from 1.5 lakhs right up to 4 or 4.5 lakhs for major changes, structural changes, revision rhinoplasties. And we get a lot of revision rhinoplasty cases as well. So that was my lowdown on the recovery process of a rhinoplasty. I'm sure you have a lot of questions. Shoot them to us. Please allow my team to help you get the right answers that you're looking for, and whatever you read on the internet is not true. If you've already undergone a rhinoplasty, then I think it is best to keep away from Google and trust your surgeon in the process. If you like this video, do share it with your friends and do subscribe to SB Aesthetics because we keep posting such informative content regularly. Thank you for watching.